Hi, I'm Garvin. This telecast is on Brilique. So Brilique, what is it used for? It's for reducing the risk of atherothrombic events, such as heart attack, stroke, further heart attacks or death in people who have had a heart attack or are having severe chest pain caused by unstable angina. Brilique tablets are given in combination with low-dose aspirin, unless aspirin is unsuitable. So how does it work? Brilique tablets contain the active ingredient Ticagrelor, which is a type of medicine called an antiplatelet, sometimes referred to as a blood thinning medicine. Ticagrelor works by preventing the action of a natural substance called adenosine diphosphate, or ADP. ADP is one of the chemicals in the body that causes platelets to clump together and start the process of blood clotting. Brilique binds to a specific area on the platelets known as the P2Y12 receptor. So how do you take it? Brilique tablets are usually taken twice a day. They can be either with or without food. You should not stop taking this medicine until your doctor tells you to. If you stop taking Brilique too soon, this may increase your chances of having another heart attack or stroke. It's not to be used in people with any active bleeding, for example, from a peptic ulcer or brain hemorrhage, and people who have recently had bleeding inside the skull, intracranial hemorrhage, and also moderate to severely decreased liver function, and in people taking the antifungal ketoconazole, the antibiotic clarithromycin, ritonavir, or atazanavir for HIV infection, or the antidepressant nefazodone. It's not to be used either in pregnancy or breastfeeding. This medicine is not recommended for people having kidney dialysis or people with kidney problems caused by raised levels of uric acid in the urine. The safety and efficacy of this medicine in children and adolescents under 18 years of age has not been established. It is not recommended for this age group. This medicine should not be used if you are allergic to any of its ingredients. Please inform your doctor or pharmacist if you have previously experienced such an allergy. If you feel you have experienced an allergic reaction, stop using this medicine and inform your doctor or pharmacist immediately. So pregnancy and breastfeeding. So there is no information available about the safety of this medicine for use during pregnancy. The manufacturer states that it is not recommended for use during pregnancy and that contraception should be used to avoid pregnancy while taking this medicine. Seek further medical advice from your doctor. Also, it is not known if this medicine passes into breast milk. The manufacturer states that it should not be used during breastfeeding. Mothers who need to take this medicine should not breastfeed. Again, seek further medical advice from your doctor about this. So the main side effects, the common side effects would be nosebleeds, bleeding at injection sites, bleeding in the stomach or bowels, bruising, shortness of breath, and more uncommon side effects would be headache, dizziness, disturbances of the gut such as abdominal pain, nausea, vomiting and diarrhea, indigestion, inflammation of the stomach or gastritis, bleeding gums, bleeding inside the skull or brain and bleeding in the eyes, coughing up or vomiting blood and blood in the urine, vaginal bleeding, rash or itching. The side effects I've just outlined may not include all of the side effects reported by the medicine's manufacturer. For more information about any other possible risks associated with this medicine, please read the information provided with the medicine or consult your doctor or pharmacist. So how can this medicine affect other medicines? It is important to tell your doctor or pharmacist what medicines you are already taking, including those bought without a prescription and herbal medicines, before you start treatment with this medicine. Similarly, check with your doctor or pharmacist before taking any new medicines while taking this one, to make sure that the combination is safe. The medicines listed below increase the blood level of Brilique, which could increase the risk of its side effects. These medicines should not be taken in combination with Brilique. So these are atazanavir, clarithromycin, ketoconazole, nefazodone and ritonavir. The medicines listed below may also increase the blood level of Brilique, but to a lesser extent than the ones I've just said. They should be used with caution in combination with Brilique, and those are amprinavir, aprepitant, cyclosporin, diltiazem, erythromycin, fluconazole, quinidine and verapamil. So the next lot of medicines may decrease the blood level of Brilique, which could make it less effective. These medicines should be avoided where possible while you are taking Brilique, and these are carbamazepine, dexamethasone, phenobarbital, phenytoin and rifampicin. There may be an increased risk of bleeding if Brilique is taken in combination with the next set of medicines, which also affect blood clotting. And they would be clopidogrel, dabigatran, dipyrimidine, and glycoprotein inhibitors such as tyrofobin, also heparin, iloprost, and low molecular weight heparin. Medicines that break down clots, thrombolytics, for example, alteplase and streptokinase. Also non-steroidal anti-inflammatory drugs like naproxen, ibuprofen and diclofenac. And oral anticoagulants such as warfarin, rivaroxaban, and the SSRI antidepressants such as fluoxetine, paroxetine and citalopram, and venlafaxine. If you're taking any of these medicines that I've just mentioned, you should be carefully monitored for any signs of bleeding during the first weeks of treatment with Brilique and following any surgery. So if you have any questions, you can contact me through the Life Pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.